Hey everybody, it's Dr. Brace here for Facial Plastics Friday, and today I want to talk about rhinoplasty. I was thinking about calling this hackers, rhinoplasty, and summer surgery and talk about all three things, so maybe I will. So it's hackers, rhinoplasty, summer surgery, what you need to know. And so first thing, hackers, I want to put a message out there to all of our patients, any patient out there for any surgeon. Be careful of some pretty elaborate phishing schemes going on. We recently had somebody impersonate our office asking patients for payments to be redirected to a Gmail account. This did not come from us. This is not anything we would ever do. Payments over e-transfer only ever come to a facialplastics.ca account, the one that you're provided at a consultation. And so if you are going to be having surgery here with me, with us, or at any surgeon's office, and you get an email, even if it looks like it comes from your surgeon's office, that's directing you to send money to some other random account, and you haven't been told that on the phone or in person by somebody you trust and know, please call your office of the surgeon right away and let them know, because this is happening recently with a number of different practices. So that's hackers. Number two, rhinoplasty. Rhinoplasty is probably the most common procedure that I perform, somewhere around 150 to 170 rhinoplasties a year, and most of them I do open or external approach, and some of them I do endonasally. But specifically with rhinoplasty, I want to touch on a couple things. Number one is osteotomy. So I'm going to use the whiteboard today and draw my cartoon nose. So if you think of the nose, the upper third is made up of the nasal bones, the paired nasal bones. That's right up here. These are connected through an area called the keystone area to your septum and your upper lateral cartilages. So the upper lateral cartilages make up the mid vault of your nose, the middle part of your bridge. So if you feel the bones and then come down towards your tip right there, upper lateral cartilages. And then the tip is made of these paired cartilages that are curved, and they're called the lower lateral cartilages, or the alar cartilages. Then skin is over top of all of this. You've got your nostrils, your columella, your tip, your nostrils are right in here that you breathe through. But this is the structure of your nose. And so what are osteotomies? Osteotomies are the medical words for bone cuts or bone breaks, controlled cuts in the bone. There's a number of different ways to do osteotomies and a number of different reasons to do osteotomies. If you cut the nasal bone here, this is called a medial osteotomy. Most patients need a medial osteotomy to straighten a crooked nose or to allow placement of certain grafts. So grafts will come on the middle here to widen their nose, and otherwise to fix an asymmetry if one side is bigger than the other. And so usually we do these as a fading medial osteotomy, meaning they're going off to the side. They fade off to the side and they meet what's called a lateral osteotomy. Lateral osteotomy starts inside the nose, right above the turbinate. The turbinate is the structure that warms and humidifies air. If you look inside the mirror, inside your nose, you'll see a little pink bulge there. So right above the turbinate, we come in and we do a high to low to high osteotomy. And that breaks the bone along here and up and lets us medialize or push a nasal bone into the middle. So osteotomies are used to close an open roof, or lateral osteotomies are used to close an open roof. An open roof is if you have a big bump and we shave it off. You now have two bones that are no longer, they used to be touching, the peak has been shaved and now open, your skin will sink down in and you'll have this open roof deformity. So you do lateral osteotomies to push them together. You do lateral osteotomies to help straighten a crooked nose, and you do lateral osteotomies to fix an asymmetry in someone's nose. This sounds like it would hurt a lot, and surprisingly, it doesn't. So I give all my patients medications for pain after surgery, usually Percocet, and almost every single person comes back and says, I didn't use them, I just used Tylenol and Advil, what should I do with these? And so although nasal surgery, facial surgery sounds like it might be really painful, you may hear horror stories of people that have had septoplasty or septal surgery in the past where they had packs in their nose and had a lot of pain. Here in my practice, we use really light nasal packing. It's a Telfa gauze cut in half, one half inside each nostril overnight, and it comes out the next day. And that is not uncomfortable really at all. The discomfort from that is that you have a stuffy nose, but not pain. And then the bone breaks here cause bruising under your eyes. I use a tiny little osteotome, a 2mm osteotome for probably 90% of my osteotomies. And if the bones are a little bit thicker, I'll use a 3mm osteotome. These are straight. They're almost like little chisels. They're straight and they cut the bone. They're really sharp. They don't cause a lot of damage to the soft tissue like some of the older style, larger, guarded, curved osteotomes. And so rhinoplasty is the most common surgery that I do in my practice. Almost everybody gets osteotomies because usually we're taking a bump down or straightening the nose. And everybody comes back and says, I thought that was going to be a lot worse than it was. It really wasn't that bad. And so that brings up the topic of summer surgery. A lot of people plan to do rhinoplasty in the summer because they want to have their nose healed and ready for the next chapter of their lives. Maybe they're going back to school or to a new school in September, starting a new job in September, maybe moving to a different town, different city, different part of the world. How much time do you need to recover? It's about 2 weeks. Most people here in Canada take time off in the summertime to enjoy the summer that we have here. And 2 weeks is more than enough time to recover from a rhinoplasty. What will you be recovering from? Well, it's not really pain, it's swelling and bruising. If we do bone cuts, you're going to have a bit of bruising and swelling in this area here. Usually by day 7 when we see you to take the cast off, your bruises are already yellow. So they're past the purple, red, pink phase. They're already yellow. They're days away from being resolved. They're easily covered with makeup if you want to do that. And they're basically going to be gone in a few days. So at 1 week, they're yellow. At 2 weeks, they're gone. An exception to that would be somebody that has a lot of tear trough filler here. I've found that when we do osteotomies in those patients, if they get a bruise, it can linger a little bit longer because it's in the gel, in the hyaluronic acid gel, and it kind of sits there a bit longer as a kind of a darker area. And that can linger, but it's easily covered with makeup, and we can use pulsed dye laser. If you are the exception to the rule and you come back at 1 week and you still have purpley red, pink bruises, we use the pulsed dye laser complementary to break down that bruise to get rid of it for you faster. Usually a red purple bruise hit with the pulsed dye laser today will be light pink tomorrow and gone in 2 to 3 days. And so rhinoplasty in the summertime is a great option for most people who are about to start the next chapter of their lives. And a lot of people mistakenly think that they need a lot of time to recover from it when you really don't. Cast for a week and stitches for a week if we're opening the nose. Bruising, swelling resolved pretty much at 2 weeks. You're socially acceptable. The swelling in your nose does take a year to go down, but we're talking about 2 millimeters of swelling at most, kind of done at the tip. So it's not really that noticeable to really anybody except for yourself and to your surgeon. So I hope that answers some of the questions. Watch out for the phishing schemes in email trying to take your money. Contact your surgeon's office if you have any questions about any communications you may have received, which are probably mimicking their office and not really from them. Osteotomies, bone breaks to straighten a crooked nose, to close an open roof, to fix an asymmetry or for graft placement and widening of the nose. In summertime, it's a great time to have surgery. If you're thinking about a rhinoplasty, because the recovery is quite easy, you probably already have time off. The other popular time is Christmas break, because people usually have time off and they can kind of sneak a rhinoplasty in while they're away from work. And for teachers and those who get March break, that tends to be the other popular time, but summer is probably the most popular time for people to consider that surgery. Everybody have a great weekend. Happy Facial Plastics Friday.